name is Jacqueline Drexler, and I am a product audiologist. I am here to present on Phonak Marvel hearing aids and amplified stethoscopes. This presentation serves as a guide for how amplified stethoscopes can be configured with Phonak Marvel hearing aids for auscultation. An amplified stethoscope helps to compensate for hearing loss by amplifying bodily sounds. However, not every available amplified stethoscope will be an option for medical professionals with hearing loss. In addition, there are no specification standards with stethoscopes, so we must take care of statements that suggest the stethoscope provides up to 100 times, 40 times, or 60 times amplification, as it is not clear what level this is relative to. It is important for medical professionals with hearing loss to be aware and counseled that heart and lung sounds may not be perceived the same when listening through hearing aids. It may be necessary to listen and learn what they need to practice for during auscultation, as well as demo an amplified stethoscope that would suit their listening needs most appropriately. For the rest of this presentation, medical professionals with hearing loss will be referred to as clients. Auscultation is the act of using a stethoscope to listen to internal sounds of the body. Through auscultation, medical professionals can analyze heart and lung sounds for differential diagnosis. This can be a challenge for clients, as heart and lung signals are considered very soft, low-frequency sounds. Consequently, there is a limitation in hearing aids to achieve the low-frequency bandwidth needed for auscultation, as this falls well below the frequency region for speech understanding. For example, lung sounds may range from 70 Hz to 4,000 Hz, with most signal detection falling below 2,000 Hz, and heart signals may range from 20 Hz to 650 Hz. Stethoscope earpieces are designed with an unincluded ear canal in mind. Thus, the earpieces are competing for space that is occupied by a hearing aid. One consideration is to use an amplified stethoscope with over-the-ear or on-ear headphones. This allows the hearing aids to remain in the ears during auscultation. The configurations for an amplified stethoscope with headphones include on-ear headphones with hearing aids that have open or large venting, allowing auscultation signals to be transmitted via direct sound. This is ideal for clients with normal or near normal low-frequency hearing. Over-the-ear or on-ear headphones with custom hearing aids create a separate manual program with more low-frequency gain. Over-the-ear headphones with BTEs or RICs and custom ear molds to cover the hearing aid microphones create a separate manual program with additional low-frequency gain. It is possible to stream signals from a stethoscope to Phonak Marvel hearing aids. There are different configuration options depending on the chosen stethoscope. These include direct Bluetooth connectivity with a Bluetooth-enabled stethoscope, Bluetooth streaming via a Bluetooth transmitter plugged into the stethoscope, or Roger direct streaming via a Roger microphone plugged into the stethoscope. So now let's do a demonstration of how we can configure the amplified stethoscope with a Bluetooth transmitter or a Roger microphone. So here I have the ThinkLabs 1 stethoscope. It is not Bluetooth enabled, however it does allow for connectivity with a Bluetooth transmitter to stream the auscultation signals from the stethoscope to the hearing aids. So I'm going to show you how we can set up the Bluetooth transmitter. So first, before you begin, you want to make sure that the Phonak Marvel hearing aids are paired to the transmitter. After it is paired to the transmitter, you can go ahead and, using an audio accessory cable, plug it into the transmitter, and then using the adapter cable so that it can plug into the stethoscope. And now that the client should be able to perform auscultation and have the signal stream to the hearing aids via Bluetooth. If the client wishes to use a Roger microphone, we can just unplug this cable. And then we just make sure that before you connect it to the stethoscope, that the Roger microphone is paired to the hearing aids. After it is connected to the hearing aids, we go and plug in the appropriate cable into the select, and then again into the stethoscope. And now the stethoscope is configured to stream auscultation signals from the stethoscope to the hearing aids via Roger. Regardless of the chosen stethoscope, consider these hearing aid factors. Coupling. Choose a custom ear mold with minimal or no venting or power dome. The more occluded the coupling, the lower the risk of low-frequency leakage. Receiver power. Select M receiver or greater. Low-frequency gain. A low-frequency boost is provided by default within the streaming program. The amount of gain and range of frequencies affected is dependent on the ear mold vent and the receiver power of the hearing aid. Attenuation of the hearing aid microphones. Consider how clients would like to hear their patients when performing auscultation, and adjust the attenuation of the hearing aid microphones in the streaming program accordingly. Manually mute the hearing aid microphones or reduce the microphone level while streaming. This can be configured in the fitting software. MPO. Reduce the MPO only if the client is experiencing distortion while streaming and performing auscultation. This would be most applicable for clients with an ear mold vent. The larger the vent, the greater the risk for distortion. In addition, consider these streaming factors. Latency. Streaming via Bluetooth may have a slight delay in signal transmission compared to streaming via Roger. Compression. Reduce the volume on the stethoscope if the client is experiencing distortion in the signal. Increasing the volume on the stethoscope may lead to clipping of the streaming signals in the hearing aid. Ambient noise. If the streaming device has external microphones, such as the Roger Select, make sure they are muted while performing auscultation. Ease of use. The hearing aids automatically switch into the streaming program upon detection of the Bluetooth or Roger signal. If the client wishes to have manual control of when to enter and exit the streaming program, this can be configured for Roger only in the fitting software. Here is an overview of the amplified stethoscopes that are currently on the market and the connectivity features they offer. Listed are ThinkLabs 1, EcoCore, and Duo, the Littmann 3200, Cardionics eScope, and eCorde. The connectivity options are traditional ear tips, plugging in a Roger microphone into the stethoscope via an audio accessory cable, Bluetooth connectivity to the hearing aids either directly or via a Bluetooth transmitter plugged into the stethoscope, visual display recording, and streaming a recorded playback of the measurement via an app to the hearing aids. Please note there may be other options available on the market that are not listed here, and for further information about each amplified stethoscope, refer to their website. To wrap up today's presentation, here are a few takeaways. Not every available stethoscope will be an option for medical professionals with hearing loss. Recommend that clients practice and learn what they need to listen for, as bodily sounds may be perceived differently via the hearing aids than without the hearing aids. Heart and lung sounds are very soft, low-frequency sounds and may be detected at a frequency level below the bandwidth of the hearing aids. Use an amplified stethoscope with headphones to allow the hearing aids to remain in the ears during auscultation. Auscultation signals can be transmitted via direct sound if the client has normal or near normal low-frequency hearing with an open fit, or create a manual program with additional low-frequency gain for a more closed fitting. Depending on the stethoscope chosen, streaming auscultation signals from a stethoscope to the hearing aids can be possible via Bluetooth or Roger. When using the Bluetooth or Roger configuration, consider these hearing aid factors to help enhance the listening experience, including the acoustic parameters, receiver power of the hearing aid, low frequency gain, the attenuation of the hearing aid microphones, and the MPO. In addition, consider these streaming factors, including latency, compression, the environment of the client's workplace, and ease of use in switching in and out of the streaming program. Here is a list of references you can refer to for further information on amplified stethoscopes and hearing aids. And that is all I have for you. You can download the Phonak guide attached to this presentation or from the audiology training page. The guide contains all the information that was presented today. Thank you for your time and for listening in.